A lot of patients don't understand what happens in the IVF laboratory, and this is a big mistake because it's the IVF lab which is actually the heart of an IVF clinic, and the results of the IVF clinic, the success rate and the pregnancy rate, is dependent on the experience and expertise of what happens in the IVF lab. And it's the embryologists, the doctors who actually work in the lab, who are the real unsung heroes of the IVF treatment. But unfortunately, we don't give them enough respect, partly because they work behind the scenes, as a result of which a lot of patients don't even understand what happens. And this is why it's so important that you make sure that your IVF clinic has a full-time embryologist in the IVF lab who does only that. That way you're sure that he has enough experience and expertise and can do a good job with growing embryos to day 5, freezing your embryos, and thus maximizing your chances of achieving a pregnancy. The sad tragedy in India is there are not enough experienced embryologists, as a result of which a lot of IVF clinics depend on what I call imported embryologists, which means they fly in, they do the procedure and then go back. But this is not always in the patient's best interests, because then what happens is batches are put together, and then irrespective of whether your eggs are ready or not, you're forced to do the IVF treatment at that point because the embryologist is going to go back. And the only way to make sure whether you're going to get the best possible treatment is by learning to ask the right questions and making sure that there is a full-time IVF embryologist in the clinic which you choose. I'm Dr. Aniruddha Malpani, and I'm more than happy to answer your questions. Our website is at www.drmalpani.com.